So optimal glycemic control depends on kind of which guidelines you're looking at. And so the two major bodies that we have are the ADA guidelines as well as the ACE guidelines. The ACE guidelines favor more stricter glycemic control, and so they're favoring an A1C of less than 6.5 if you can reach there safely. Whereas the ADA guidelines are favoring a goal of less than 7, also bearing in mind that you need to be able to get a patient there without any, harm such as hypoglycemia. And so they do differ a little bit, but what they do agree on is kind of the approach and kind of the medications that should be used to get folks to goal. Both guidelines recommend metformin as their first line option when controlling or looking to control blood sugars. Pharmacists are in a key position to be able to kind of emphasize what needs to be done from a glycemic standpoint from a variety of ways. So if you think about those folks that are most easily accessible, it's usually your folks that are on the front lines in the community pharmacy. They have an idea of the different prescriptions that they're getting filled, a good idea of the different providers that are in and around that pharmacy. And so if patients are looking to get a referral to an endocrinologist, a podiatrist, an optometrist, usually having those relationships puts them in a very unique position to be able to kind of connect some of the dots, not only in terms of the referral of care, but also when you think about having all the different specialists and getting all the medications filled in one spot, from a drug interaction standpoint to knowing what medications are working, what medications are not working, why they're stopping certain medications, why they may not be coming back in the second month, the third month to get their medications refilled. And so those are all places of entry or areas where a pharmacist could intervene and have that discussion with that patient to dig a little bit deeper. Is it the side effect of the medications? Are you unhappy with your treatment? Are you unhappy with your provider? What are things that I can do to kind of make this process a little bit easier? When we think about drug therapy, that voice and that second time that the patients typically hear it, maybe they've heard it a little bit or a quick version of it at their doctor's office, they hear it again from someone that they've had an ongoing relationship with, they see a lot more often, that usually helps. And again, being able to hear it from someone they have a more established relationship typically also helps. The way that I work with clinicians to help them achieve glycemic goal for their patients is we work in a multidisciplinary clinic. And so my role as a clinical pharmacist and that of a certified diabetes educator is to work alongside a group of providers. And so I have 3 endocrinologists that I work with, a nurse practitioner, and we take referrals from our primary care colleagues for those challenging patients that have more complex needs. They need some of the newer agents that are out there for type 2 diabetes. We get a bulk of those referrals. And from that point onwards, we kind of take over the care and we're managing and co-managing them along with their primary care, but we'll make sure that they get on the right medications. If there's certain medications that need to be taken off, or certain ones that just might be restricted to being used by the endocrine service, those are the ones that we would kind of put on and making sure that that patient is still being co-managed, but we've kind of taken the lead in managing that specific condition.
When we receive patients, whether that's referral or walk-in to our pharmacies, that have high blood glucose, that have diabetes, that have prescriptions for diabetes medications, our number one goal is to ensure that they have access to the medication and the treatment that they need. That's the first thing. Nothing can improve if they don't have access to the care that they need. And sometimes it's out-of-pocket issues. A lot of times it's health literacy. They just don't understand that they need to access these things. We have our pharmacies in rural Missouri in the Mississippi River Delta, and our area is somewhat of a healthy food desert. And so having access just to the foods that are really important to them is something. So when they're coming in and we're talking through these things, access is the first most important thing. And then if we ensure that they have access to the medication that they need, second step is always to make sure that they understand why they need this. Health literacy, we have a lot of patients that don't read very well, don't understand, misunderstand how these things work. Once we ensure those two things happen, then we get into setting goals. What did your prescriber set as your goal? How can we work with that prescriber to ensure that we meet those goals? And then we work to ensure that we have follow-up with the patient. The more we communicate back and forth with their prescriber, primary care providers, any other referrals that we work with, whether that's through dietitian, other social, we've got community health workers on staff at our pharmacies that we refer our diabetes patients to help them along on their journey. All this information we communicate back with the prescriber. So if, for instance, access is an issue due to cost, I looked before this session and we did almost 500 prescriptions for GLP-1s last year. Well, in those, we had some patients with copays as high as $600 and some copays of zero. Access is an issue, out-of-pocket's a concern. So once we ensure that the out-of-pocket is okay, say you have a patient that $600 is too much, we contact the prescriber, explain that the situation, work through the formulary with the prescriber as a team, and we find that prescription that fits that patient's budget best. And then we move on with that as our primary treatment option in that situation. Prescriber communication is super important. It's not always 100% positively received from the prescriber. Most enjoy having another member of the team that's helping their patient through this journey and following them along the way to ensure not only that they're moving towards that goal of keeping their blood sugar under control, but also that positive outcome goal when you look at cardiovascular disease and all these other side things that can happen with diabetes.